We're going to begin by directing the first question to Superintendent Wright. Right now, as far as I understand, a lot of districts are saying we're going to bring back elementary students later this month. April 19th, I'm hearing for a lot of districts, but middle and high school students, they are going to continue the hybrid because of the infection rate in our area. Is this generally where you see things as they stand right now?
Yes. I want to start by just thanking our parents and for all their support, and I want to acknowledge the work that's been done across the counties to reopen schools. You will see some subtle differences as far as reopening of schools, but generally speaking, most schools in the county will be opening K-5 or K-6 depending on the configuration. In Rush Henrietta, we plan to reopen K-6 because we are our sixth grade is self-contained in an elementary school, so you'll see some variation based on the type of configuration. Most schools are holding off on 7-12 simply because the new guidance doesn't allow it. When schools are in a red zone, there are cohorting requirements, which are a real challenge right now, and the distancing requirement can't go from 6 feet to 3 feet at the secondary level. So to be continued as far as bringing students at the secondary level back.
All right, Superintendent Wright, thank you. We'll get back to you with more of what's happening within the districts in a moment. But first, we're going to go to County Executive Bello. County Executive Bello, you have been advocating to get kids back into the classroom full-time for some time now, talking about the CDC guidelines, encouraging the state to adopt those guidelines. At the same time right now, we're seeing the numbers of COVID-19 infections going up in our area, especially among young people. So what happens now? You were advocating for it a few weeks ago. How do you match the current reality?
Yeah, Adam, that's a great question. And you're right, I have been advocating for the schools to have more flexibility to be open, because I do believe that most of our children do a lot better with in-person instruction, and also families succeed too, because schools offer an awful lot of services not just to our students, but also to our families. But it is true. Right now we are seeing an increase in numbers of our cases amongst young people, particularly those in their 40s, 30s, 20s, and below, and we're seeing an increased number of the percentage of our positive cases in those age groups as well. And I think that's for a couple different reasons. First is because we see that the vaccine is working amongst our older population. So we're not seeing, despite the fact that we're having a surge right now, we're not seeing that large increase in the older population. They were the first allowed to take the vaccine, and now we're seeing the result of that vaccine, whereas our younger people were only just recently able to take that. But what we're seeing through contact tracing in our Department of Public Health is that the spread in cases amongst younger people is not occurring to a large extent inside the school buildings. Our schools have been doing a fantastic job, as the superintendent alluded to, in reducing the spread inside the buildings. The teachers, the administrators, making sure the children are masked. I give the children a lot of credit as well for following all the public health guidelines. Where it's happening is in those ancillary activities outside of the school building. So whether it's in different sporting events, we saw an issue related to youth hockey a couple of weeks ago, birthday parties, gatherings, things like that that are happening outside of school. And so, you know, one thing I think about oftentimes is, while grandma and grandpa may have been vaccinated, mom, dad, the kids, they have not. So we need to be smart. We need to wear our masks. We need to know what works, remember what works to lower the spread, and we need to continue to double down in doing that so that we can match what's happening inside the school buildings. If I can bottle up everybody in Monroe County and stick them inside an elementary school, we'll be a lot healthier community, because they're doing what they know works. So I'd like to see them continue to be able to do that, continue to see our kids in school, but we have to be cognizant outside of the school buildings when it comes to gatherings, birthday parties, things like that, that we do it safely.
All right, County Executive Bello, thank you. This next question is for Dr. Mendoza. When I told folks that we were doing this town hall, Kathleen wrote in she's not a fan of reopening, and that's probably because of the variants that are out there. She says they're more dangerous, they spread quicker, easier, and she wonders if the masking and the 3 feet is going to be enough for kids when they get back into the classroom.
Well, as we've learned throughout this entire pandemic, a lot of the challenge is adapting to new knowledge as it becomes available from our scientific community. We know that these variants have presented a new challenge, a challenge that we have not yet seen to date in this pandemic. But the good news is we also now have a vaccine. So in many ways, we're dealing with a somewhat different situation now than we had earlier in the fall. And while we can't say with very much certainty exactly what will happen in the months to come, I think there is some good news here, which is that the variants have very likely been in our community now for many weeks, if not months. And we have not yet seen, until very recently, a sizable change in our numbers. That leads all of us in the scientific community to conclude that the masks are working and that distancing is working. And because our children, generally speaking, cannot yet get their vaccine because it's not yet available to them, that simply means that we need to keep doing the things that we know work. Wearing our masks, making sure we keep our physical distance, and washing our hands and doing all of the routine precautions that we do in our schools. But if we can remember these very important points, these basic points that we've been thinking about now for months, I think we can come out of this even better than we were going in.
Dr. Mendoza, thank you. The next question is for Rush Henrietta Superintendent Wright. I want to talk about elementary students for a minute. So if they all start going back, let's say April 19th, what does it look like in a given day? In the classroom, on the bus? Are they going to be going to the cafeteria? And lastly, as part of this question, what should parents do to help out to make this work?
Well, Adam, I think that what you're going to see in classrooms and what you're going to see as students are transported to school is going to be very similar to what you've seen throughout the course of the year. You know, teachers have made the best of a really difficult situation. They've been able to blend technology with clever, hands-on, in-person instruction all year. And so you'll see the same types of things happening as we look to reopen. You know, I receive a lot of questions around masking. That's still going to continue to be a requirement. We're still going to be screening students every single morning. We're asking parents to help us out with that, do it before students come to school. But if we have students that haven't completed the screener, we're going to continue to do that to make sure that our students are kept safe. The capacity on buses is going to continue to be reduced, and you're going to see a continued effort to make sure that buses are disinfected. Now that the warm weather's coming, we're going to be in a position where we can hopefully open windows to increase airflow on the buses. But you will continue to see reduced capacity. When students are snacking and if they're eating meals, people have asked questions regarding breakfast in the classroom and things of that nature. We'll have to implement the new guidelines and make sure that students are distanced at 6 feet. And in the event that we can't do that, then we'll have to find other places to feed students and allow them to snack. You know, that tends to be more of an issue at the elementary level. But generally speaking, the school day and the activities that you see are going to look very similar to the way that they've looked all year, and we're just excited to be able to welcome students back.
A follow-up question to Mr. Wright before we move here. One viewer wrote in saying, why can't junior and high school students go back? And this viewer cited sports being played by these students, and then they asked, why can't they go to the classroom? What does it say in the guidelines? Why is that decision being made?
Yeah, and Dr. Mendoza, from a medical perspective, may view it differently. I think there are some perceived inconsistencies in the guidance that we received out of the state. I think people look at certain sports being played, sometimes unmasked, and they say, well, why, if my child is playing the flute, are they at you know, up to 12 feet up until last week? And, you know, if my child is taking a drink of water, why are they at 6 feet? So I can see that, you know, when someone looks at it on its face, why they may say, you know, why are they able to do this in sports and why are we not able to do this in the classroom? But we have to follow the guidance. The guidance allows us right now to bring back elementary grades. Given where we are as a county with community infection, we're not able to bring back secondary students. We're going to continue to hold out hope that we're able to do that eventually. But I think it's really going to depend on the numbers ultimately. You know, are we going to see increases here in the next 2 to 3 weeks? And then I think, you know, each district will have to make some decisions based on his or her community and the capacity that they have. And, you know, there may be a more nuanced approach. Adam and Dr. Mendoza can probably speak to that better than I can. But for now, you know, we're going to do what we can, bring back elementary students, and then wait and see what happens if we're able to bring back high school students later on. The major challenge for school districts when a county is in the red zone is that you can't reduce distancing requirements, and you also, you're required to cohort, which is extremely difficult at the secondary level.
All right, Superintendent Wright, thank you. He was talking about who would make the decision as to when junior and high school students can come back. We are going to pose that question to County Executive Bello in just a moment, but for right now we're going to take a short break and we'll rejoin you in just a minute. Welcome back to our Back to School Town Hall Coronavirus Facts First. We mentioned that elementary students across our region, a lot of them going back to school in person 5 days a week very soon. Middle and high school students, not just yet because of the infection rate in our area. So that gets to the next question, which is going to County Executive Adam Bello. County Executive, this is a two-parter. What does the infection rate first have to look like in order to even consider bringing middle and high school students back? And then who has that authority? Who makes that call?
Sure. So according to the new state guidelines, so I'll give you the technical answer and then put it in the real world. So the rule now is it's about 100 new cases per every 100,000 residents over a 7-day period. So what does that mean for Monroe County? It means that we need to get our numbers of new cases down to about just over 100 cases, around 105 or so new cases a day. You know, we were there at one point. We were just about there. We had our cases down that low. Obviously, you've seen our cases go up to between 200 and 300 a day recently. But these are the rules that are set forward by New York State, and the new rules that were updated just last week are in line with what the CDC has been recommending for some time. But I want to be clear, because there is some confusion around this. There are not different sets of rules for different counties and different school districts across New York State. New York State, just like it does on a normal school year outside of the pandemic, has set the rules and the guidelines for how schools can open, including the rate that I just described to you before. The role of the county is to work with the school districts to understand the medical advice, understand the contact tracing, and also to partner on things like test kits and other things like that to help the schools be able to work through that guidance with New York State, and also recognize that every school is going to be different. All schools are different sizes, they have different enrollments, they have different percentage of their children choosing to want to be in person versus at home learning, and when it comes to the distance and the social distancing within the schools, every school is going to have to make a different decision based on how it fits in with that state guidance. With the new guidance that came out just last week, it's at different rates now, like I just described, as to how you can bring back elementary schools versus older kids. But what the guidelines also did now was have the school districts submit plans to the county health department, and then gives the enforcement provisions to the county health department. But what does that mean? What it means is that the county health department can now work with school districts with their reopening plans. So if there's an issue, if something is happening, or someone raises an alarm that there's something wrong with the plan, the county health department can work with the school district to correct that in a way that the county wasn't charged with doing before. So there's a great partnership to be had between the county health department and the school districts with their plans, but at the end of the day, the plans have to be submitted to New York State, and it's essentially a contract between the school district and the state of New York. But we here in Monroe County have been working with our school districts since the beginning of this pandemic, since the days the schools had to close back in March of last year, to make sure that we're all coordinated, we're working together, and we're trying to get our kids back in school, but do so safely.
All right, County Executive Bello, thank you. The next question is for Dr. Mendoza. I want to talk about how easy or difficult it is for transmission amongst children now that they're going to be congregating again. Yes, at a distance, yes, with masks. But I hear a lot of people who say kids really don't transfer COVID-19. Not only do they not get very sick, they don't transfer it very easily. And what's the harm if they do transfer it because they don't get sick? What's the potential drawback there? So I was hoping you could address those points that are kind of floating out there in the community.
Well, there is still a lot that we're learning about the transmission of COVID-19 from person to person. We know that it is a person-to-person respiratory contact type of situation, meaning that if you're within 6 feet of somebody, you have a much higher chance of transmitting those respiratory droplets to another person. And if they're still susceptible, i.e. they've not had a vaccine or have not themselves had COVID, then there's a much higher probability that they will then become infected. Now, what is becoming clear is that the way children manifest their infection has a wide range. Many will not have any symptoms at all, which makes it difficult to identify them, and then others will have acute symptoms that resolve, and then still others will have what we call long COVID, meaning that they develop somewhat milder symptoms in between the first two groups, but they can linger for sometimes months, and we have a number of individuals in our community who are unfortunately dealing with all of this. So to those who say, well, children don't generally get sick, it is true. But for those who do get very sick, it is also true that we could have done, or we should be doing more to help keep them safe. And the reality is that the research is still evolving, but the research has confirmed what we've known all along, the very basics, which are that aerosol and airborne transmission are by far the most common ways that this can transmit from person to person, whether it's student to student or student to teacher.
Is it true that, Dr. Mendoza, is it true that if it continues to spread, even amongst the young, it could create new variants?
Well, that is a definite concern. And we know that the more the virus transmits, the more cases that we have among individuals, the greater the probability that the virus will have an opportunity to mutate and create these new variants of concern. And then it becomes essentially a probability game. And we don't want to play probability when it comes to people's health. And so we want to do everything we can to limit these transmissions, to decrease the number of cases in our community, to give the vaccine and time every chance it can to get ourselves past this phase and into this more normal phase, where hopefully we can have no masks and more normal interactions in our schools.
Dr. Mendoza, thank you. The next question is for Rush Henrietta Superintendent Wright, and this question comes from Veronica. We heard just a few minutes ago from Kathleen, who wants to reopen the schools, not just to elementary students, but to middle and high school 5 days a week. Veronica has a different perspective, and she asks this, Mr. Wright, why at this point of the year are they pushing for reopening when 75% of the year has already happened? There's only 25% of the school year left, and if cases are going up amongst the younger population, is now a good time to do this. She's basically advocating, let's ride this out to the end of the year, restart fresh in the fall. Your thoughts on that?
I think it's an interesting debate with strong feelings on both sides, but I think I speak for most superintendents when I say that we feel like we have a moral obligation to get students back in school. We need to address learning loss. And equally as important, we need to be able to address the social, emotional needs of students and some of the mental health issues that we've seen students experience as a result of what's happening around them with the pandemic. You know, we also want to get our school communities, our students, our staff members, our families reacclimated to a more typical school situation so that we can get our hands around what supports are going to be needed as we look to reopen more fully. We want to hit the ground running as far as planning goes for summer, and then look to fully reopen in September. I know that people have expressed concerns about safety and some of the public health issues related to community spread, but I'll reiterate what Mr. Bello and Dr. Mendoza said. Regardless of what's been happening around us, throughout the pandemic, schools have remained safe places. Our infection rates have remained far lower than what you see in the community, and I think that's a testament to the work that all schools have done to adhere strictly to the guidelines around masking, distancing, disinfecting, and hand sanitizing.
Yeah, my hat goes off to all the educators out there. Superintendent Wright, thank you. The last question, we have about 2 minutes left, is going to go to County Executive Bello. We're going to talk about vaccinations. A lot of students can get their vaccination now because they're 16 and older. So what should they know? What should their parents know? How can they sign up? If you could kind of give us a real short review there.
Sure, and actually this is timely this week because week to week we don't know which vaccine we're going to get at the county health department, if it's going to be Pfizer or Moderna. And this week we received an awful lot of Pfizer vaccine in the county health department across the community. Individuals 16 and over are eligible to receive the Pfizer vaccine. So today is a good day for parents to be talking to their children who are 16 and older, talk to their pediatrician, and sign up for a vaccine. You could do so. It's never been easier. We have 2 ways. On our website at monroecounty.gov, you can see all the appointments available at the convention center and the other county-run facilities. But we also today announced a new initiative to bridge the digital divide. We have a hotline, 753-5555. If you call that hotline, we can schedule your appointment right over the phone. It's really never been easier, and we've had a remarkable shift in the last couple of weeks where it used to be the system, you know, the appointments would go up, they'd be gone in about 5 or 6 minutes. There are appointments available right now. It's a good way for your family to go together, parents along with their high school students, again 16 and over, to get that vaccine together. And do so now. Do not wait, because we don't know if we'll have Moderna next week or after that. And you also want to think about where you want to be later. Remember, the vaccine doesn't take effect immediately. You take a vaccine, particularly right now with Pfizer, you have to wait a few weeks, you had your second shot, and then a few weeks later is immunity. So what you do today will impact your health and the health of this community weeks from now, so it's important to keep in mind. We don't want to wait. Now is the time to go consider getting that vaccine, talk to your pediatrician, talk to your doctor, make a family decision, and go get that vaccine.
All right. Adam Bello, thank you. I want to thank all of our guests, Dr. Mendoza and Mr. Wright, the superintendent over at the Rush Henrietta School District, for joining us today for this very important Coronavirus Facts First School Town Hall. We went over a lot. Before we go, I do want to note, while we're talking about elementary students going back full-time, RCSD, the Rochester City School District, has said they are going to stay hybrid through the rest of the school year, and they hope to restart in all grades, full-time, in-person, 5 days a week, all that in the fall. We're going to have more on that coming up on News 8 at 6. Again, thank you for watching. As always, these town halls are here because of you and your questions, so thank you so much. For all of the latest coverage on the reopening of schools, by the way, just click on our education section over at our website, rochesterfirst.com.